Hi everyone, my name is Beth Whittier. Welcome to my channel. I am an American Board of Radiology certified musculoskeletal radiologist. My aim is to discuss research papers in a simple and easy to understand way so everybody can understand and benefit from scientific research. So today we're going to discuss this paper titled Evaluation of Time to Reimplantation as a Risk Factor in Two-Stage Revision with Static Spacers for Periprosthetic Knee Joint Infection. This paper was published in the Journal of Orthopedics and Traumatology in March 2024. In many cases of chronic knee joint infection, where the patient already has a total knee arthroplasty, a technique called two-stage exchange arthroplasty is done. So first, a temporary spacer is placed in the joint, and this helps to stabilize the joint and maintains the length of the leg. And the spacer may also release local anti-infective substances like antibiotics. And then later on, in the second stage, reimplantation surgery is done, where the final joint replacement hardware is put in place. Now, there is a lot of discussion about what is the ideal time interval between putting the spacer in and the final reimplantation. The authors of this retrospective study evaluated the relationship between time to reimplantation with respect to risk of reinfection, mortality, subsequent surgeries, and functional outcomes for the patients. And they found that time to reimplantation was actually associated with an increased risk of reinfection, which means that the longer the interval between putting the spacer in and the final reimplantation, the more the risk of the patient getting that joint reinfected, especially after 94 days. Hence, they recommend reimplantation in a two-stage exchange surgery with static spacers before 94 days. If you enjoyed this video, please give me a thumbs up and subscribe to my channel. If you have any questions or any other articles you would want me to review, please let me know in the comments below. Thank you.